Hello friends, once again welcome to the new session of Hospital and Clinical Pharmacy. Myself, Ms. Malvi Rajendra Bhavsar, M.Pharm in Pharmaceutics. So today we are going to deal with a new chapter, that is drugs in clinical toxicity. So after watching this, student will be able to learn how to classify the poisons and treatment of poisoning. First, we'll start with the introduction. Human poisoning could be accidental, suicidal, homicidal, or due to stupefaction. Poisons generally used for suicidal purpose are potassium cyanide, oxalic acid, hydrocyanic acid, opium, barbiturate, organophosphorus compounds, and arsenic. Poisons used for homicidal purpose are antimony, aconite, organophosphorus compound, strychnine, and oleander. The poison used for stupefying purposes are datura, belladonna, hyoscyamus, cannabis, and cigarette containing arsenic, etc. Accidental poisoning commonly occurs as a result of carelessness with the poisonous and non-poisonous material that are stored together. Number of cases of accidental poisoning have been reported from the greater use of chemical in industries and for household purpose. Now next we are going to study classification of poisons. So poisons are classified according to their mode of action. Accordingly, poisons are classified into three main groups. So first is corrosive, second is irritant, and third is neurotics. So first, corrosive. A corrosive poison is simply highly active irritant and not only produce inflammation but also acute ulceration of tissues. For example, first, strong acids like sulfuric acid, nitric acid, and hydrochloric acid. Organic acids like oxalic acid and carbolic acid. Concentrated alkalis like caustic soda, caustic potash, and carbonates of sodium, calcium, and potassium. Second is irritant. Irritant poisons produce symptoms of pain in abdomen, vomiting, and purging. Corrosives in dilution solution act as an irritant. Examples of irritant are first, inorganic. So example is non-metallic and metallic compound. The non-metallic poisons are phosphorus, chlorine, bromine, iodine, and boron. The metallic poison consists of arsenic, antimony, mercury, silver, iron, copper, bismuth, and lead. The organic poisons can be divided into two types, that is vegetable poisons and animal poison. Vegetable poison include castor oil seed, croton oil, Abrus precatorius, colocyanate, ergot, marking nut, and aloes. Animal poisons consist of catharites, snake venom, scorpion venoms, and poisonous insect. Third, mechanical. This group includes powder glass, chopped hair, sponge, and dust powder, diamond dust. Then third category of poisons is neurotic. These poisons primarily act as a central nervous system. The chief symptom of this type of poison include headache, drowsiness, giddiness, delirium, stupor, coma, and sometimes paralysis. Then the poison in these groups are again classified as first, poison having specific action on cerebrum. This poison may have a somniferous or delirious effect. The somniferous poison include opium and its alkaloid. The inebriate one include alcohol, anesthetics, ether, chloroform, sedatives, and hypnotics, chlorhydrate and barbiturate, and insecticides like organophosphorus compound, coal tar, insecticides, and amphetamine. And the delirious one include datura, belladonna, hyoscyamus, and cocaine. Poison acting specifically on spinal cord. So this category include Nux vomica and its alkaloid and gelsemium. Then poisons acting peripherally. The poison acting a peripherally nerve include conium and curare. Then the poison in human beings are poisoning are of two types. So first is acute poisoning and second is chronic poisoning. Acute poisoning, the symptoms of acute poisoning appears immediately after the ingestion of poison. They increase in severity and may follow death. The poison can be detected in digested substance of vomit, stool, and urine of victim. The main symptoms are vomiting and diarrhea or convulsions and coma. And second, chronic poisoning. The symptoms of chronic poisoning appear gradually. The symptoms may disappear after removal of victim from his surrounding. Poison can be detected in digested substance or stool. vomit and urine of the victim. The main symptoms are chronic ill health, paralysis, repeated attacks of GIT irritation, and increased cachexia. Then we will see general treatment of poisoning. So first is removal of unabsorbed poison from the system, use of antidotes, elimination of absorbed poison, treatment of general symptoms, and maintenance of patient general condition. These are the generally 5 steps or 5 methods which can be used for general treatment. So one by one we will discuss all the methods. First we will discuss removal of unabsorbed poison from the system. So if first is inhaled poison, if the poison is inhaled. So when poisons like carbon monoxide or gas from septic tank is inhaled by patient, he must immediately remove to fresh air and artificial respiration must be given. Second, if the poison is injected. If poison has been injected, tourniquet must be applied proximal to the site of injection. So unabsorbed poison can be removed by the means of incision and again suction. Then contact poison. If the poison is a split or a spread on the skin, eye or a wound or be inserted into vagina, rectum or bladder, it must be washed with the plain water, and if specific antidote is known, it should be used for neutralizing that poison. Then ingested poison. The most important thing is to remove the ingested poison. It can be brought about by vomiting or by washing the stomach. And by washing the stomach means this method is also known as gastric lavage. Then second, use of antidotes. First, physical antidote. So these are the substances which inhibit absorption of poisons, like demulcents such as fat, salts and albumin. The demulcent forms the coat or mucous membrane of GIT and thus inhibit the absorption of poison. Fat and oil should not be used as antidote in phosphorus poisoning since phosphorus is soluble in it. Then banana is the best antidote for the glass poisoning. Charcoal is used to absorb the alkaloidal poison. Then chemical antidote. It is a substance which interact chemically with the poison to form an insoluble precipitate which is non-toxic or it is oxidizes the poison to its non-toxic form. Now like poisons like acid, so antidote used is magnesium oxide, calcium oxide, carbonic acid. Poisons used are magnesium sulfate for lead, sulfates or alkali, oxalic acid lime, phosphorus. Antidote uses copper sulfate, and for alkaloid antidote uses tannin. Then physiological antidote. It is a substance which produces effect opposite to that of the poison without interacting chemically with it. These are the antagonists of poison. Sometimes the antagonism may be incomplete and antagonist itself may produce adverse effect. So for example, morphine, antagonist is naloxone, organophosphorus, compound example is atropine. Then chelating agents are the substances which produce to form non-ionized cyclic complex called as chelate with cations. The important chelating agents are BAL, that is BAL, EDTA, penicillamine and desferoxamine B. So first is BAL, that is British Antilluist or dimercaprol. It is a chelating agent used in the treatment of heavy metal poisoning. The heavy metals have an infinity for thiol groups and combine with them in body tissue, displacing hydrogen and depriving the body of these enzymes whose activity depend on thiol group. If dimercaprol or BAL is administered sufficiently in excess amount, the heavy metal react with it and thus protect from the enzyme system of the body. The resultant complex formed is stable and excreted without any damage to the liver or a kidney. BAL. It is administered in a dose of 3 to 5 mg per kg intramuscularly at the interval of 4 hours for the first 2 days, then interval for 4 to 6 hours for additional 2 days, and interval of 6 to 12 hours for additional 7 days. Then EDTA, that is ethylene diamine tetraacetate. Again, it is a chelating agent which has a great affinity for the lead. The chelated lead is excreted in the urine. Short courses of the treatment are advised to avoid depletion of metallic ions essential for metabolism. So dose is 75 mg per kg 24 hours intramuscularly or slow IV infusion given in 3 to 6 divided doses of 5 days. may be repeated for second course after minimum interval of 2 days. Each course should be exceeded a total of 500 mg per kg. Third is penicillamine. It has a stable SH group which confers the chelating action. It is a less toxic than EDTA and can be given orally. It is used in copper, lead and mercury poisoning. It is also used in treatment of hepatolenticular degeneration, that is Wilson's disease. Dose for penicillamine 100 mg per kg per day, max 1 gram in divided doses for up to 5 days. For long-term therapy, it should not exceed 40 mg per kg per day. Then desferoxamine. It is a chelating agent which chelates the iron in the stomach and binds the iron in the blood. Thus, it is useful both orally and intravenously for avoiding systemic absorption and removing absorbed iron. Oral, it is dose is orally 8 to 12 gram in 40 to 60 ml distilled water, IV, or 2 gram in 5% of levular solution. Or 140 mg of desferoxamine can bind about 1 gram of ferrous sulfate, that is 200 mg of iron. Then universal antidote. It is an antidote in case where nature of poison is not known or a combination of poison is administered. So universal antidote has a formula like ingredient powder charcoal, magnesium oxide and tannic acid. So 2 parts of powder charcoal, 1 part of magnesium oxide and 1 part of tannic acid forms universal antidote. So role of powder charcoal is adsorb alkaloids, magnesium oxide will neutralize this acid and tannic acid will precipitate alkaloid. Then third one is elimination of absorbed poison. Eliminated by catheterization may encourage forced uresis using intravenous chlorothiazide or mannitol infusion. It is useful in aspirin and barbiturate poisoning. Then peritoneal dialysis is useful in salicylate poisoning. Hemodialysis has been employed or removed barbiturates, boric acid, bromide, glutatiamide, salicylates, etc. Treatment of general symptoms. Morphine should be given for the pain, oxygen for respiratory failure, cardiac stimulant or feeling particular symptomatic effect of poison. Maintenance of patient general condition. Fifth one is maintenance of patient general condition. So patient should be kept warm and comfortable. In case of poisoning, especially in adult patient, there is possibility of upper respiratory tract infection. So to avoid this, prophylactic administration of antibiotic is also desirable. So now one by one we will see different cases of poisoning and their treatment. So first one is poisoning by insecticide. In that, first organophosphorus compounds. So this compound include alkyl phosphates and aryl phosphates. So alkyl phosphates are hexaethyl tetraphosphate, tetraethyl pyrophosphate, octamethyl pyrophosphamide and malathion. Aryl phosphate examples are parathion and diazoxanide 20. So symptoms of these poisons are: first, poison affect the smooth muscles and gland and then vital brain center. So fatal dose for HETP is IV or IM 160 mg and orally 350 mg. Treatment for this poisoning is decontamination. Second symptoms are initially headache, paralysis, constriction of chest and pinpoint pupils. After few hours, nausea, vomiting, diarrhea, abdominal cramps, sweating, salivation and muscular twitching also observed. In severe poisoning, pulmonary edema, coma, convulsions and death may be result. So fatal dose for OWA, it is by IV or IM 80 mg and orally 175 mg. And treatment for this poisoning is artificial respiration, positive pressure respiration, tracheostomy if required. Then TEPP, that is tetraethyl pyrophosphate poisoning. So fatal dose is IM and IV 45 mg, oral 100 mg. Treatment given for this is antidote therapy, atropine 2 mg by intramuscular or intravenous after every 15 to 30 minutes to counteract the muscarinic effect of acetylcholine. Malathion, fatal dose is 1 gram. Parathion by IV and IM 80 mg, oral 150 mg. And diazoxanide